This is Dr. Christopher Sundy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss at-home ketamine therapy versus IV ketamine therapy and how do you choose one over the other. So how exactly does ketamine work? Well, we're going to go ahead and simplify this again. And effectively what ketamine does is it works through the glutamate system. And the glutamate system is a key neurotransmitter system present in mammals, in the cortex in particular, in which glutamate, which is an amino acid, is involved with the formation of synapses and synaptic plasticity through signaling at key neurons. Now, it's been found that depression and mood disorders result in basically a loss of neuroplasticity, a loss of synaptic formations, and there's actually even a loss of neurons in many cases. And so what ketamine does is effectively, through a low-dose infusion, causes increased neuroplasticity through the production of proteins in neurons that allows for dendritic spine formation. And dendritic spines are basically where new synapses or connections form among neurons. So ketamine effectively repairs underlying neural circuits damaged by depression, and it does so rapidly and robustly, unlike any other treatment out there. And this also allows for an improved regulation and balancing of glutamate, which is a very important key neurotransmitter in the cortex. And by doing so, it allows for other neurotransmitters to function normally, such as serotonin and dopamine. And this is an example of a synaptic formation between two neurons, and as the dendritic spines meet, they form a synapse. This is an example of ketamine as it produces proteins allowing this synaptic formation. Now, ketamine infusions are the most rapid method of achieving remission and response in depression. Ketamine infusions are one of the most studied forms of ketamine use in depression and mood disorders. It is the gold standard, and 6 to 8 infusions twice or 3 times per week with 40-minute sessions with dosings between 0.5 to 1 milligram per kilogram IV drip has been what has been the most effective method of achieving depression treatment rapidly, and dissociation is not needed to achieve clinical results. But effectively what ketamine does is it produces increased neuroplasticity with synapse formation that starts within hours of the treatment that's finished. Now, the other neat thing is that when ketamine is given, within an hour after the ketamine infusion, ketamine is out of your system. So if you're feeling better and your mood is improved, it's not because you're buzzed on ketamine, but actually because synapses are starting to form in key areas of the brain that allows your brain to function better. Now, the main side effects of ketamine infusions are nausea and dizziness, and that can last several hours. Generally, within the first 30 to 40 minutes after the infusion is done, most people feel much better, and about 5% of patients will complain of nausea. Generally, with pre-treatment with antiemetics, patients do quite well, and most are able to tolerate the treatment without any side effects. Now, you can't drive for about 4 to 6 hours after an infusion. However, most are able to work the next day. You feel perfectly fine. But if you get ketamine infusions towards the evening, sometimes your sleep can be affected on the night of the infusions because it could be a little bit activating. And when do you see results with your ketamine infusion series? Generally around the 3rd or 4th infusion out of the 6th or so infusion, you'll start to notice that the needle moves in terms of your mood in a number of different parameters. So this is an example of a ketamine infusion room. This is actually not a ketamine infusion in process. However, generally speaking, the individual will be in a dark room, usually with music. They'll usually have the drip occurring over that period of time. They can usually drink fluids during the session. Most individuals are perfectly awake, although they are slightly in an altered state of consciousness depending on the dosing of the ketamine therapy itself. Now, integration with psychotherapy is definitely important in the treatment process, but that integration doesn't have to occur until a couple of days later. So in-session ketamine assisted psychotherapy is really not that effective from what we have found. In fact, there are some places where they'll do group intramuscular sessions, and something like that can be quite intrusive and sometimes even problematic for patients. There is no actual proven evidence to show that in-session CAP therapy is actually effective in improving outcomes. However, definitely integration with psychotherapy, which refers to the actual psychotherapy sessions being performed after ketamine is done, maybe a day or two later, even beyond that point in time, has been found to be very helpful in augmenting the response to ketamine and also prolonging its effectiveness. So generally, when somebody gets ketamine infusions, it's an inward cognitive journey, unlike maybe psilocybin MDMA, which can be a little bit more of an emotional type of a journey. Ketamine, of course, affects the glutamate system, whereas other psychedelics affect the serotonin system. So again, ketamine is a treatment, not a cure. And the goal is remission of depression and mood disorders. So it's important to recognize you have to have maintenance booster infusions from time to time. Usually those are monthly infusions, but sometimes you need to come in sooner than that when things start to get worse. And what's very helpful in kind of that maintenance program is using at-home microdosing of ketamine, whether it's intranasal ketamine, troches, ready-to-dissolve tablets, or other types of formulations to kind of allow the person to maintain the benefits of their infusion therapies. And ketamine infusions work to augment underlying medications, so they can make your underlying antidepressant work better. And if you're starting a new antidepressant, it may even make it work faster. Now, this does require lifestyle changes. You have to work on your lifestyle, and you have to work with a psychotherapist to help change maladaptive behaviors and identify maladaptive habits that you've developed because of your underlying mood disorder. And you also have to address addiction treatment concerns as well as behavioral interventions to change specific behaviors that might not be very effective in terms of what is going on in your life. Now, it's important to also focus on trauma with appropriate therapy as well. And ketamine works extremely well when other treatments fail. Now, which do I choose? At-home ketamine therapy or infusions? Well, ketamine infusions are most likely to produce remission and response. And meta-analysis demonstrates that ketamine infusions are about threefold more likely to produce remission or response relative to S-ketamine, which is Spravato, and that's the FDA-approved treatment. And basically, there are fewer dropouts, even fewer side effects with IV infusions relative to Spravato. Now, the problem with the Spravato is that you're given a fixed dose all at once in a physician's office. And so such a large dose sometimes can be a little bit overwhelming, whereas ketamine infusions are dripped in over a period of time. Now, we know that ketamine infusions are controlled easily by an IV drip. They can be started and stopped instantly. And there's 100% bioavailability. So you're getting the ketamine over a steady state dosing over a period of about 40 to 45 minutes. Now, an example of IV versus oral treatment differences would be if we compare like antibiotic use for infections. So, for example, if somebody has a really bad infection, you don't use oral antibiotics to treat it. They need IV antibiotics. And the reason you do IV antibiotics is to achieve adequate blood levels because there's less liver metabolism whenever you take an IV versus oral antibiotics. And so the same would apply for ketamine. So if you want to get the best effective dosing and get ketamine to where it's needed the most, which is, of course, in the brain, an IV drip only makes sense because you're going to get a great area under the curve. And this drip of ketamine allows ketamine to get to where it needs to be at the highest percentage. Now, cost may certainly affect your choice between IV ketamine versus oral ketamine, but your chances of remission are a lot higher with initial IV therapy and then use maintenance therapy with at-home oral and intranasal ketamine and periodic booster infusions. Now, just to recognize also that you have to factor in the cost of your ride to the treatment or the availability of a person to bring you back and forth from your treatments. You can't drive after IV ketamine therapies. However, you are definitely going to be able to see and sense results more rapidly with initial ketamine infusions. Now, as far as when you analyze the results, the marketing of many online ketamine centers, looking at the cost that they advertise actually can add up to several $100s more per month than doing initial IV ketamine therapies. So a lot of these centers will state, it's like $70, $80 per week, which is about, $400, $500 a month in many cases, and even more. And some of them will state that they have guides that can help you, through this whole journey. And this can be kind of misleading because they're not therapists. They're not individuals who are truly trained for any type of treatment or helping an individual through a difficult situation. And they're not therapists and they're not available in person. So that's one issue, that when you're looking at, whether you want to do at-home ketamine therapy versus IV ketamine, how is this going to work for you? And likewise, a lot of the online ketamine centers will just kind of offer cookbook type treatments with, maybe just a few protocol dosings of, specific oral ketamine that they provide maybe once a week. And they promote these as more of a journey experience. And there's no real research at all that says that this journey experience actually results in outcomes of improved mood or improved depression. And we definitely know that ketamine infusions as a series has clear evidence demonstrating remission and response in maybe 60 to 70% of patients who have failed everything else. And again, ketamine infusions in these series are not being promoted as journeys, but rather as neuroplastic events that are actually treating the underlying problems that produce depression. Now, when you look at the online ketamine centers that are basically marketing the journey experiences, they're doing them weekly and like maybe one treatment per week or a series of 6 treatments. But what's interesting is when ketamine infusions are done, we're doing it 2 to 3 times per week for a series of 6 and even 8 infusions. And this is all based on medical-based evidence, on studies that have demonstrated that when you run these treatments in a multiple time format over a period of about 2 weeks, that you get consolidation of results. And it's kind of hard to explain how you would get a consolidation of results if you're just doing a journey of ketamine at home once a week. There's been actually no evidence to say that that works in that fashion. And so there's some misunderstanding about ketamine, is that it's really a dissociative anesthetic that is used at low doses, sub-anesthetic dosing, to promote neuroplasticity and neural repair. And we've discussed this in some of our other videos. And it really treats the underlying problems that produce depression as it restores glutamate balance. And effectively, as you restore this glutamate balance and you do this neuroplastic repair, you sculpt the tone of serotonin and dopamine so that they work better. And a lot of places will kind of use the construct of psychedelic treatments like psilocybin and MDMA, which are more serotonin-based therapies, and kind of use their construct in the context of ketamine therapies, that the journey somehow is therapeutic. And the journey certainly can be enjoyable and fun, but just because it's enjoyable doesn't mean that it relates to outcomes. And so a lot of people kind of focus on the signal of ketamine as opposed to the actual results of neuroplasticity, which occurs a day or two later when the person has no ketamine in their system, but rather there's neuroplastic repair of broken circuits in the brain. And so the signal of ketamine represents kind of that buzz, that kind of journey feeling, the elation and the kind of mind journey that people have. And that's really not what people should be focused on, but rather what happens the day or two after the ketamine is taken, what's going on inside the brain. And it's really about neuroplasticity and glutamate rebalancing. And as I mentioned earlier, glutamate is the major neurotransmitter of learning and pain perception in the cortex of mammals. So oral or IV ketamine? Well, basically when you get a dose of IV ketamine, you're getting effectively 40 to 60 milligrams of IV ketamine dripped slowly over 40 minutes. That's an average dose, and that's somewhere around the mid-range of dosing for individuals as they're going through this series. And when you get this IV ketamine, it's 100% bioavailable, whereas an oral troche of ketamine, like this one over here, it could be anywhere dosed from 30 milligrams to 1,000 milligrams or more at some online ketamine centers that are promoting journeys. And so when you look at these oral troches, about 20% of it is bioavailable. So if you get 1,000 milligram troche, you're going to get 20% of that within several minutes. That's going to be like 200 milligrams. And just to let you know, this is an IV bottle of ketamine with 500 milligrams of ketamine inside of it. And this is enough to treat about 7 people in their first series. So 7 people, and that's 500 milligrams, whereas this could be as much as 1,000 milligrams. And so, again, it's important to recognize that, when you're doing at-home ketamine oral therapies, you're really not looking for a journey or a high dosing, but rather what are the therapeutic responses? And that's what you should be titrating your dosing to. And so the thought behind the higher dosing of oral ketamine through some of the online centers is that, well, let's go ahead and try to get as high a dose in the bloodstream that simulates what you would get through IV ketamine. So, if somebody's getting 1,000 milligram troche and you get 20% of that, well, that's going to be 200 milligrams, which is a lot higher than an IV drip over 40 minutes. And they're going to be getting this amount in a very short period of time, which is, again, I think for some individuals quite alarming and can certainly be, fraught with side effects, whether it's going to be a negative experience or side effects of nausea or extreme dissociation, whatever it might be. So, the best way to use oral troches would be to really just titrate them based on clinical efficacy, but not try to aim for what you would get in an IV infusion experience. And there's no proof that doing so would actually work, from oral ketamine itself. Now, the work around, this oral ketamine using ultra high doses, again, is designed to mimic an infusion in some online centers. But again, you never really know how much you're going to get when you put this underneath your tongue, because again, the dosing may be variable. The way the troche is made can be variable. Again, it's made in a compounding pharmacy, and it can certainly be asymmetric, and you can also have variable absorption based on maybe what you've eaten or how much saliva you have in your mouth or whether you spit it out or swallow it. And again, you're more likely to get side effects if it's a super high dose. So again, the goal behind this is not to go on a journey, but rather to get good results of neuroplasticity the following day when the ketamine's out of your system. So again, there is no association of dissociation with results. So you don't have to lose control in order to make ketamine work. So these are just, again, examples of what ketamine troches and tablets and the different formulations can look like. Now, why would you choose at-home ketamine therapy? Well, basically, what we find at Nova Health is that at-home ketamine therapy is really best used as maintenance therapy after initial ketamine infusions and also in between booster infusions. Now, it can certainly be used as pain management, as troches, nasal spray, and sustained release formulations and tablets as well. But you can also use ketamine oral and intranasal at-home ketamine therapy for initial treatment when the goal is relief of symptoms as opposed to remission of symptoms. And so again, oral ketamine and intranasal ketamine used at home is more likely to produce kind of relief of symptoms as opposed to really what you want to get is remission of symptoms. That means it's like completely gone. Now, it'll take a lot longer to produce response with oral and at-home therapies relative to IV therapies, but it may be cheaper, even a little bit more convenient, simply because you can do it at home. But you could certainly use at-home ketamine therapies to augment your underlying antidepressant therapies and the medications. But it does require, again, like IV therapies, continued psychotherapy, behavioral modification, lifestyle changes, and addiction interventions to maximize results. So again, you need to address things like alcohol use and opiate use disorder and other things to maximize these results. Now, again, dosing of these types of at-home therapies are based on clinical outcomes and not on a journey. You don't base it on the signal of ketamine, which is that trippiness of the feeling. So you don't have to feel anything really to get results with at-home therapy. Now, what are some of the examples of at-home therapies? We have ketamine troches, which are these kind of waxy or firm tablets that are placed between the cheek and gum. And you hold it under the tongue for about 10 minutes and it dissolves. And then what you do is you either swallow it or you spit it out. Now, if you spit it out, obviously you don't get the entire dosing of ketamine. But if you swallow it, there's more potential for nausea and cramps. Now, for microdosing, you really shouldn't feel any trippiness. You shouldn't feel any journey. And if you do take a larger dose and you're going to feel effects, well, you'll start feeling it within 5 to 10 minutes. And the amount of those effects can be variable and change from time to time. And so sometimes we'll hear patients say, well, I don't think it's working. And the question is, well, what do you mean by that? And they'll be like, well, because I don't feel any of the trippy effects that I normally feel. But you're not really supposed to feel anything like that when you're doing at-home ketamine therapies. Now, just as a reminder, only 20% of ketamine troches are absorbed, and it rapidly gives an increase of ketamine levels inside the bloodstream. So you have the effect for a kind of potentially large, trippy feeling whenever you use oral troches. And of course, there's no driving for 4 to 6 hours after use simply because of balance. And again, dosing should be based on clinical outcomes, not based on the trippy feeling that the person has or based on trying to dissociate somebody. Now, the doses used could be 30 milligrams or even up to several hundred milligrams a few or several times a week based on some centers. But generally speaking, 100 milligrams, even 200 milligrams, 2 to 3 times per week should be plenty to get the actual clinical results that a person may need. Now, other examples of clinical of ketamine troches, again, we've described some of the processes, but again, you want to dose this to clinical efficacy, not the journey and not the signal. And this may take several weeks to work, so you don't want to expect this to be working within a day or two, but it again will take several weeks because again it's not 100% bioavailable and it's not as powerful in terms of its effectiveness as IV ketamine. And this is really just again best used as maintenance after infusions. And for some people, they can start with at-home ketamine therapy and consider doing a few infusions to augment the response to at-home ketamine therapies. Now, there are very few medication interactions with ketamine. Certainly, benzodiazepines can decrease ketamine's effectiveness, but otherwise, it's an extremely safe medication. Now, the cost of ketamine troches are really based on the dose and the size of the troche itself, but it could be anywhere from $5 to $8 per each troche. And then there's ketamine ready to dissolve tablets, rapid dissolving tablets that are basically placed under the tongue and kind of burst open. They can provide a higher absorption rate, but they do have the typical bad taste as any ketamine product has. And then there's ketamine dots. For those with lots of anxiety and insomnia who are looking for some rapid relief, this is an example of something that may work really well for these individuals. And you're getting about 30 milligrams of ketamine and about 2 to 3 milligrams of midazolam, which is a benzodiazepine, kind of like a Xanax, and ondansetron, which is an antiemetic. This allows the person to get rapid relief from panic attacks and anxiety, as well as if they get insomnia from using ketamine in the evening. This can be helpful in kind of giving the person an ataraxia, which is kind of a relaxed state. Now, the average cost is about $6 to $10 per tablet, and it's something you would use just periodically, not on a regular basis. Now, as I mentioned at earlier video, that ketamine can be quite activating in the sense that it actually can worsen insomnia if it's taken too late and if it's taken at bedtime in particular. And then there's ketamine sustained release capsules. These are slow release pain treatments that you would just swallow, and for some individuals these work well. They're taken in 50 to 200 milligram doses a couple times a day, for again, depending on what the pain management need is. And then there's also ketamine tablets, which is another formulation, and generally it's used for pain management in various dosing formulations. And finally, ketamine nasal spray, which is absorbed about maybe 40 to 60% of the total dosing is absorbed. It's compounded in variable concentrations, but at higher concentrations it can crystallize. And this is examples of 10%, which is like 10 milligrams per 0.1 ml or 100 milligrams per cc, all the way up to 20%. Now the problem is, as you go higher on the percentage, the side effects are a little bit higher and the medication can crystallize. But it is rapid acting, and it's easier to titrate to effect. And people can use it in multiple ways, whether they use single sprays scattered throughout the day as a form of kind of relief, or multiple sprays all at once, just a few times per week, to kind of emulate the IV ketamine treatment process. But again, we're using this as a treatment based on clinical outcomes, not the trippiness. So we change and alter the dose based on the patient's response. And again, no driving after the use of this product. This is something which is used only in the house, and it's important to follow the prescription and the guidelines on the bottle. But this can certainly be useful for rapid symptom relief. And the cost is about $60 to $130, depending on the volume and the concentration. So let's say about 20 to 30 cc's for a month's supply of maybe 10 to 15% ketamine may be about $100 from an average compounding pharmacy. But the main issues we see with this are breaking the bottle, issues with the nozzle, spills, and then just kind of utilizing the formulation in the nose. So my conclusions and suggestions, basically, you have to look at what your diagnosis is and what your goals are. If you're looking for remission, then IV ketamine is really the way you want to start. If you're just looking for relief, then you're certainly can use the at-home ketamine therapy, but you're kind of doing half measures in that case. So the best option would be to start with the IV formulations and transition to the at-home ketamine therapy, because you have the highest chance of getting remission, which is where you want to be. And it's a lot easier to use at-home ketamine therapy to maintain remission than to produce remission. And of course, doing a cost analysis, obviously the treatment using at-home therapy can be a little bit cheaper, but IV therapies are extremely effective. So if you look at your ability to get back to work and function and your quality of life, that may be a critical factor that kind of balances out a slightly higher cost of IV infusions. And again, infusions are the gold standard treatment, but certainly at-home ketamine therapy with nasal and oral ketamine can be effective in maintenance therapy after infusions, or as a way to prime the individual for ketamine boosters. And so you can certainly start with at-home ketamine therapy, and it can provide relief more often than remission, and then maybe transition to IV therapies and not necessarily do the full series, but just do a few to kind of augment what you've gained from the at-home treatments. Now, again, you have to combine these treatments with traditional medications, psychotherapy, support, lifestyle changes, and addressing addiction concerns as well. And again, a wide array of ketamine products are available, whether it's going to be nasal sprays, RDTs, troches, or IV infusions, whatever the person's needs are. There are a number of ways to formulate ways to make things work better for the individual.